All right, welcome to the Experience Better video podcast series. I'm Josh Buechler, PT, and today I have David Fangmeyer, PTA from the Grand Island Physical Therapy Clinic, and we're going to talk about shoulders and shoulder instability and just different things that can happen with the shoulder. So David, talk to me about a little bit of a couple things, common problems of the shoulder, where people get into trouble.
Yeah, a lot of the stuff we see with our shoulders is a lot of overuse injuries, things work-oriented, years of wear and tear on the shoulder,
Sure.
and the rotator cuff starts to wear down.
Right.
We see some instability issues with muscle imbalance. And
Tell me about muscle imbalance. Like, what muscles get, when you say imbalance, what does that mean?
Yeah, so a lot of times we'll see tightness in the upper trap. We'll see a weakness in the posterior rotator cuff.
Right.
So a lot of times what happens is the ball is not staying in the socket where it needs to be,
Right.
and we're getting too much movement, which causes inflammation, and a lot of times can lead to a rotator cuff tear or labral issues or impingement syndromes.
Sure. So labral issues, you hear a lot about that, even like with athletes and all that kinds of stuff. What kind of rehab goes into effect with a labral injury?
Yep. So a lot of times with the labrum a lot of times acts like a suction cup for the humeral head or the big arm bone that goes in the socket, the ball in the socket. So when that labrum is injured or you lose that suction on the socket. So what we do is we try to strengthen all the muscles around the joint in order to better stabilize the shoulder.
Help that suction.
Exactly, exactly. So basically try to make up for what the labrum's job is, because it's not performing its job like it should be.
And that's relatively successful?
We do see a pretty good success rate with that. A lot of times with labrum tears, we can strengthen all of that up and we're able to avoid surgery for a lot of those patients. We're starting to see
huge benefit.
Absolutely.
So, very good.
Yeah.
So, kind of going back to, like rotator cuff tears and, tell me a little bit about, I hear a lot about shoulder impingement. So what are kind of the mechanics behind the impingement syndrome?
Yeah, so a lot of times too, like we were talking about with the ball not staying in the socket, there's a lot of ligaments and like the bursa, which when that ball is moving in the socket and gets out of where it's supposed to be, it starts impinging on those ligaments and tendons and that bursa can get inflamed, and then we see a lot of things happen where a lot of times surgically they have to go in and shave some of that down and clear the space so that it can.
And what's kind of neat is a lot of times in those situations, you talked about those muscle imbalances earlier, we can stretch those muscles that are tight, strengthen the ones that are weak, and a lot of times that kind of gets us back from being that shoulder being too far forward in the socket to kind of get it back to where it needs to be. So a lot of good we can do for shoulder issues, shoulder pain. Tell me a little bit about the sports academy you guys are doing, specifically with the overhead type athletes.
Yeah. So one of the issues we were seeing, especially with like baseball players and our throwing athletes, volleyball players, is we're seeing these kids that they start with, say, football, and then they go to another sport, and then baseball comes around. Well, they haven't thrown in months. They've been doing other sports, and then they pick up a baseball and they start.
And they go to town.
Yeah, absolutely. They get after it. So what we're doing is we started doing some preventative camps where we really work on strengthening the rotator cuff, working on a lot of times in baseball where the injuries come, it's not necessarily the acceleration of the arm, but it's the deceleration of the arm, trying to slow it down. So we work on the muscles to help decelerate the arm, strengthen those up, and two, it's very common that baseball players, just because of the amount of wear and tear on the shoulder, have some sort of labral issue. So we work on stabilizing the ball in the socket, and just doing what we can to keep them on the field.
Right. So the sports academy you talked about, so that's something that people are able to sign up for and join, and you guys would provide some one-on-one training and specific individual exercises to
exactly
those kids, so.
Yep. So we do our camps on a 6-week basis.
Okay.
We do 2 times a week.
Mm-hmm.
So you would pick a date that works for you, and
right.
we'd go 6 weeks. And we've actually, with our last camp, we even worked around the sports moratorium that we just had with the kids for school. So we split it up 3 weeks and 3 weeks, and that almost gave us an extra week where they could work on it on their own too.
Awesome.
So
Got
a little added benefit.
So if anybody's interested in that, where can they sign up for it?
They can find us on Facebook or Instagram. Central Nebraska Athletic Academy is the name of it, and then they can contact us through there, or they can call the sports clinic here in Grand Island as well and ask to talk to any of us. So,
well, thanks for joining me.
Yeah,
David.
absolutely. Thanks for having me.
Be sure and come see David here at the sports clinic, or at the Grand Island Physical Therapy Sports Clinic. Check out the Central Nebraska Athletic Academy. They're doing great things with that. And thanks again for joining us. So, see you next time.